Hi, good evening, all of you. I'm Dr. Komal Saini, Assistant Professor in Chandigarh College of Pharmacy, Mohali. I'm going to present my topic Preclinical Study of tetrahydrocurcumin loaded lipidic nanoparticles incorporated into tacrolimus ointment and in vitro and in vivo safety study. I have worked on atopic dermatitis by using tetrahydrocurcumin nanoparticles with tacrolimus ointment. So, firstly, what is atopic dermatitis? It's a chronic, relapsing inflammatory skin disease, and it has lesions of eczema. AD affects up to 20% of children and 10% of adult worldwide till date. That is making it most common skin condition. So, in accordance to a global burden of disease survey 2019, they ranked atopic dermatitis to be 15th among all the non-fatal disease and highlighting its significant impact on quality of life and its role as a major contributor to years lived with disability. In terms of pathogenesis, the cause of dermatitis still unknown, but it has some factors which includes that is inflammation, oxidative stress, skin barrier dysfunctions, and last is compromised immunity. There are number of therapies available for atopic dermatitis. So there are first line drugs, second line drugs, and some antihistamines and phototherapy with antibiotics also. So first is topical corticosteroid, which includes hydrocortisone and betamethasone. This is first line drug, and in second line there are topical calcineurin inhibitor (TCI), that is tacrolimus, pimecrolimus. Tacrolimus is available in protopic form, in concentration with 0.03% and 0.1%. So there are some side effects of this drug, but there are some antihistamines and phototherapy available, which can manage the sleep disturbance and skin infections. Secondly, I have selected the drug that is tetrahydrocurcumin, which is hydrogenated molecule of curcumin. Curcumin has some limitations like staining property and it degrades at 7 pH. So I have selected this drug, and it is also known as white curcumin, and it has some properties like curcumin. So it exhibits like antioxidant, anti-inflammatory, and antimicrobial properties in comparison to parent drug curcumin. There are four hydrogen groups you can see in the slide. So THC is a reduced analog of curcumin with phenolic and beta keto moieties because it has para-hydroxy and keto functional group that makes the THC to be a strong antioxidant as compared to curcumin. So it is an underexplored molecule and currently hold application in skin inflammation, so that we can manage, and it has some capability of free radicals on the surface of the skin. So next, I have selected the drug that is tacrolimus. So it's a calcineurin inhibitor, second generation drug, is also a immunosuppressant, and it has property to inhibit the production of cytokines, and even it can bind to the FKBP12 intracellular protein. So it can suppress the inflammation. So I have used the combination of tetrahydrocurcumin and tacrolimus as well. But tacrolimus has some side effects like redness, itching, burning sensation, and it has carcinogenic potential also. US FDA in 2016 gave the black box warning of tacrolimus. So we can use tacrolimus in less concentration like 0.03% and 0.1%. But with tacrolimus, there are some cases of malignancy. So I have used the less concentration of tacrolimus with tetrahydrocurcumin because there are some synergistic effect. I have selected the drug tetrahydrocurcumin, that is THC, but it has some also limitation like poor aqueous solubility, that is 0.0056 microgram per ml, and it has high log P value, that is 2.98, but curcumin has 3.27. But there are some poor bioavailability issues. So I have made the nanoparticles of THC. So I have selected the approach that is nanotechnology because nanotechnology has some specific drug targeting effect, and with the help of nanotechnology we can enhance the bioavailability and we can stabilize our molecule. And also Nanotechnological approach reduces the toxicity so that we can maintain the therapeutic effect and therapeutic efficacy of our drug. So it has greater safety and biocompatibility with all the drugs, and so we have used this approach. So in nanoparticles terms, we have solar-lipid nanoparticles, NLCs, that is nanolipid carriers, polymeric nanoparticles, liposome, micelles, microemulsion, and phospholipid complexes, and SMEDs also. So in nanoparticle approaches, I have selected one method, that is solar-lipid nanoparticles, because we are using in SLN surfactant, lipid, and co-surfactant, so it can entrap the drug uh, into the matrix. So solid lipid nanoparticles consist of nanoparticles, that is solid lipid particles, which are dispersed in water or in aqueous surfactant solution, because it has high drug payload, and we can avoid the use of organic solvent, because we are using aqueous solvent here, aqueous solution, that is water. And we can prepare the control release of drug, and by coating with attaching ligand to SLNs, we can increase the drug targeting, and we can produce the large scale batches also. And there are feasibility of incorporating both the drugs, that is hydrophilic and hydrophobic as well. So with the help of solid lipid nanoparticles, we can enhance the bioavailability, and we can reduce the toxicity of drug. So this is my hypothesis, that is nanotechnological intervention with nanoparticles of tetrahydrocurcumin. So I have prepared SNNs of tetrahydrocurcumin for this atopic dermatitis. So I have used this approach to increase the permeation rate across the skin, because in nanoparticles we are using small particle size of our particles, and we can increase the retention time on skin surface, and we can reduce the doses of drug due to enhanced bioavailability. So this is my hypothesis for preparing the nanoparticles of tetrahydrocurcumin. So this is my synergistic combination approaches. So I have used THC SLNs, tetrahydrocurcumin lipidic nanoparticles with 2%, and tacrolimus I have used 0.03%, because it can inhibit the calcineurin protein. So that is FKBP12, that is intracellular protein, and we can inhibit the T cell activation, so that it can suppress the inflammation by suppressing the effect of cytokines, basically. So THC SLNs have antioxidant and anti-inflammatory property. So I have used this against atopic dermatitis. So with our approaches, we were able to inhibit the production of interleukins, TNF alpha, and IFN. So and we can also reduce the side effect of tacrolimus. So that's why this is a synergistic combination I have used. So these are my objectives, that is development of lipidic nanoparticles of tetrahydrocurcumin. Secondly, I have characterized the lipidic nanoparticles with particle size, zeta potential, and total drug content, FTIR, that is Fourier transform infrared spectroscopy. So after that, I have incorporated the lipidic nanoparticle into the topical ointment containing tacrolimus, and stability studies, and in vitro mechanistic pathway using human dermal fibroblast cells. And next is acute dermal irritation and toxicity study as per OECD guidelines. And lastly, histopathological examination. So firstly, I have selected some liquid lipid surfactant solvents for our drug, that is tetrahydrocurcumin. So on the basis of these studies, I have selected one surfactant, that is 380, and second co-surfactant is phospholipid 90G, and third is lipid. Because in solid nanoparticles we need lipid matrix, so I have selected compritol 888 ATO on the basis of solubility study. So next is development of formulation. So I have prepared lipidic nanoparticles by using microemulsification technique, followed by high-speed homogenization. So quinine, phosphatidylcholine, and water, because we are avoiding the organic solvent. So I have used water plus THC. And second is compritol, that is lipid I have selected. So I have prepared clear microemulsion after congealing into the cold water. So this is hot microemulsion formed, and with the help of high-speed homogenization for 20 minutes. So this is my solipid nanoparticles that I have prepared with the help of microemulsification technique. So for this method, the patent has been granted in 2021 for the method of nano formulation of tetrahydrocurcumin, and even we have published paper for this. So second, my career is ointment. So preparation of THC SLN's loaded tacrolimus ointment. I have lyophilized the nanoparticles by using trihalose cryoprotectant, that is 5%, and on the basis of particle size, zeta potential, and polydispersity index, I have selected the cryoprotectant trihalose and just lyophilize the nanoparticles, and lyophilized nanoparticles after that added into the ointment base. So ointment base I have selected, that is white beeswax, hard paraffin, liquid paraffin, petrol atom, and in this I have added one drug, that is tacrolimus, which I have selected 0.03%. So next is characterization. For nanoparticles, I observe particle size 166 nanometer, which is less than 200 nanometer. So it can easily permeate through the skin because the particle size is very small. And with the PDI 0.247 and zeta potential minus 15, so that's why we can say the R formulation is stable. And TDC is 96.6% and entrapment efficiency is 90%. So on the basis of particle size, TDC, and entrapment efficiency, we can confirm the suitability of our method for loading THC into the lipidic nanoparticles. So next, have done NTA, that is nanoparticle tracking analysis, which is based on light scattering and Brownian motion to obtain the particle size distribution into the sample. So we can observe or we can measure the concentration as well as the Brownian motion of our particles with the help of nanoparticle tracking analysis. So in this study, we obtained the particle sizes 109.4 nanometer for our particles. So I have done for drug as well as blank formulation. So next we have HRTEM, that is high resolution transmission electron microscopy. So I have performed this study on THC SLNs and THC tacro ointment, which revealed the spherical particle size in range of 100 to 200 nanometer, and we obtained with the spherical shape. And second characterization is FTR, that is Fourier transform infrared spectroscopy. So we can observe the complete encapsulation of both the drug into the formulation, and we found that there is no physical interaction between the excipients that I have used for my formulation. So on the basis of this study, I have performed DSC, that is differential scanning calorimetry. With the help of this study, we observed the broad endotherm and amorphous nature of the drug. So in this study, we also found there is no physical interaction between the excipients and drug. So we can say the successful incorporation of both the drug in the SLNs as well as ointment. So next is SEM, that is scanning electron microscopy. So with the help of SEM, we observe the morphology of our particles, and TTO is THC SLN's tacrolimus ointment. It shows the porous material and dispersed flake arrangement with compact point. But in terms of blank ointment, it shows the smooth surface with irregular shape. And in lifeless sample, we can see the spherical structure embedded in the mass of trihalose, as we can see in the picture also. So next is pH and spreadability. So pH 6.58 was obtained for the nanoparticles and ointment. And there is one study I have done, that is spreadability factor. So this indicates the easy application of THC tacro ointment with the use of slight shear on the skin. So the consistency was good for our formulation. So next is texture analysis. So in texture analysis and rheological behavior, both the ointment, that is blank ointment as well as THC tacrolimus ointment, exhibited the decrease in viscosity upon increase in shear stress, which shows the shear thinning behavior. So this is suitable for our topical formulation because we need shear thinning behavior. So we have observed this behavior of our formulation. And next is in vitro occlusion and ex vivo occlusion. With the help of this study, we can observe the transepidermal water loss, and which was assigned to ability of lipidic nanoparticles to form an adhesive layer upon the dermal application, and thus occluding the skin surface to avoid the water loss. So, with the help of this study, we can observe the transepidermal water loss. So, this is a need for skin study. So, next is stability study. So, stability studies have done on the basis of ICH guidelines, that is Q1AR2, which was performed on THC SLNs and ointment as well. So, the formulation were found to be stable up to 2 years at all the temperatures, that is 25 degree, 40 degree, and for THC SLNs, I have performed for 4 degree also. So next I have done with colloidal stability, and THCSLN showed no aggregation as indicated by particle size and PDI. So I have performed this study in media, fibroblast media also, because I'm going to use the human dermal fibroblast, for which I have used fibroblast media, uh, this formulation, and water I have used. So the colloidal stability was performed in three solvent or in water also. So next is in vitro cell line study. Cell viability study I have performed in Hackett cells, HDF cells, and NHEK cells. So in Hackett cells, there was no cytotoxicity in the cells up to 20 microgram per ml. It shows the biocompatibility of treatment group, for which I have selected blank SLNs, tacrolimus only, THC SLNs, that is tetrahydrocurcumin nanoparticles, and tetrahydrocurcumin drug only. So this study I have conducted in University of Central Lancashire, for which I have selected in Commonwealth Scholarship Commission in UK in 19. So I have performed all these cell line studies there only. So it was concluded that all the ingredient in the formulation were safe and non-toxic for topical administration. So next, I have done quantitative uptake and qualitative uptake. Uh, in quantitative, it demonstrates the concentration dependent uptake shows increase in uptake with increase in THC SLN's concentration. So, with the help of cell viability study, I have selected 20 microgram per ml concentration, which is safe for human dermal fibroblast cells. But I have used up to 40 also, because it can show the uptake also. So in terms of qualitative uptake, RTHC SLNs, that is rhodamin dye, I have used for this study, showed the nanoparticle can be taken up by cells through the cell membrane, and green fluorescence you can see confirm the presence of rhodamin THC SLNs, that is tetrahydrocurcumin lipidic nanoparticles. Next is quantitative endocytosis pathway. I have performed with 4 temperature. 37 degree in statin I have used cytokalasin B sucrose, for clathrin pathway, and cytokalasin B I have used for micropinocytosis and phagocytosis, and 4 degree for energy dependent endocytosis, and nystatin for caveolae or lipid raft pathway, that I have performed in for chemical also. So our findings indicated the THC-SLNs followed clathrin-mediated pathway in HDF cells. Clathrin means it showed the sucrose endocytosis inhibitor pathway. However, active energy-dependent endocytosis and micropinocytosis also contributed to the uptake in HDF cells. As you can see in the image, the mean fluorescence intensity with nystatin, it is around 3000, but with cytokalasin, it's around 2500, and with sucrose, it's less than 500. So, I have selected this pathway on the basis of this study. So, next, I have done reactive oxygen species, that is ROS. It displayed the antioxidant effect in LPS induced ROS. LPS is lipopolysaccharide, which is the component of gram negative bacteria, and it releases the cytokines in the cells, in the various cells. So I have used LPS for inflammation of the cells. As you can see in image, A is normal HDF, that is human dermal fibroblasts, and second is LPS induced inflammation in cells. So in combination therapy, we can suppress the inflammation caused by LPS. So reduce the oxidative stress by squeezing free radical in HDF cells. So that is given in this figure also. So our formulation was found to be stable, and our formulation can reduce the inflammation in the cells, which is caused by LPS. So next is in vitro wound scratch assay for cell migration. I have performed in HDF cells, in NHEK cells, that is normal human epidermal keratinocytes, and the combination of both the drugs I have used in this method. So complete wound closure was observed after 24 hours of tested treatment, which is attributed to enhanced cell migration. As you can see in the image, first, so they enhance the cell migration, which is essential feature of wound healing process, particularly during the tissue formation phase. So THC formulation was found to be stable, and it can enhance the cell migration after the treatment of 24 hours. As compared to control also, we can see the effect of our formulation. So next is interleukin 6. The treatment with tacrolimus and its combination with TSC-SLN, we can see the decrease in level of interleukin 6, and the combination can reverse the negative impact of LPS, because LPS was used for inflaming the cells. So the formulation with, I have selected two concentration, that is 1 microgram per ml, that is very less concentration, and second is higher concentration, that is 20 microgram per ml. So with the help of these concentrations, uh, we can see the wound healing, for so that we can reduce the inflammatory conditions. So TSC-SLNs in combination with tacrolimus can reverse the negative impact of LPS to promote wound healing by reducing the upregulated inflammatory conditions. So this interleukin 6 I have performed in HDF cells. And last is in vivo study, that is acute and chronic dermal toxicity study, that I have performed in accordance to OECD guidelines, that is 402 and 410, acute and chronic. So uh, I have taken rat for this study. So I have performed this study up to 28 days. After that, I conducted biochemical and histopathological assessment, which shows the no irritation in skin and no irritation in the organs. So for this, I have selected 5 groups, that is control, TTO, that is THC, SLNs, tacrolimus group, and one is marketed, that is protopic, and fourth is THC, SLNs, and blank nanoparticles. So there was no significant difference was found between control and TTO groups, that is our treatment group, and with our formulation there was no mark of skin reaction in skin, and no significant changes were observed in any of treatment group. So this is my conclusion for this presentation. So nanoparticles I have prepared by using microemulsification technique, and particle size was found to be 166 nanometer, and TDC, that is total drug content and entrapment efficiency, was estimated to be 96% and 90%, and NTA was used to measure particle diffusion directly by particle, and we obtained the particle size 109.4 nanometer. And with the help of HRTM, uh, we observed the spherical particle size. FTR, DSC confirmed the formation of THC SLNs, and SEM study shows the external morphology. And in occlusion study, higher occlusion factor was obtained in comparison to marketed formulation, and both the formulation were found to be stable at all the temperatures, 25 and 40 degree also. And in colloidal stability, there was no aggregation was found in the formulation, that was indicated by particle size and polydispersity index, and no cytotoxicity was found up to 20 microgram per ml, that shows the biocompatibility of the treatment group. And the findings showed the clathrin mediated pathway, as well as energy dependent also. And the combination therapy suppress the inflammation uh, induced by LPS in the cells, and complete wound closure by in vitro wound closure method was observed in by the treatment of THC and its combination. And also with this combination, we can reduce the level of interleukin 6. So I wish to highlight here the proposed THC Tecro ointment is a unique combination of concentrated lipidic nanoparticles of THC, that is 2% with tacrolimus 0.03% in ointment base, and it didn't show any sign of skin inflammation. So because it exhibits the antioxidant and anti-inflammatory effect, and there was one synergistic action of both the drugs. So these are the publication of this research, and we have published papers, and one is under process. Thank you.